Okay, so in a few minutes, I'm going to discuss with you the epidemic situation in Jordan, quick opportunities and challenges that we are facing, what's the urban experience, and how is the road for success or failure that we have faced in our struggle against COVID. This slide is from yesterday. So as of yesterday, we have 27 million cases around the world in one of the statistics. And if you look at this slide, it seems we have COVID-19 everywhere now. So the more red, the more the intense the cases. So we are everywhere. No island, no area in the world is now safe from COVID. And this is very important because we cannot keep Jordan isolated from other parts of the world. So there are now need for more actions and different strategies to deal with COVID-19 than in the beginning. These are the cases in Jordan. These are the cumulative cases in Jordan. If you look here, we started here. The slope, the curve was flattening. Then now, in the last few weeks, we are going up. You see some notch here, and I think this notch is about when we started to take the drivers out of the equation because they are not representing local cases. But we are going up. Now we are around 2,500 cases in Jordan, and last night we had 20 cases of death. So 20 cases of death and 2,500 cases in Jordan. As Dr. Munir said, this is a very important slide. In order to look for how you're doing around the world, you need to look how cases per million. So if you look here, and I am having slides and curves for the surrounding countries, Qatar, Bahrain, Kuwait. Qatar, for example, they have 41,000 cases per 1 million of the population. Bahrain is 32,000. Jordan, as of yesterday, 236 cases per 1 million population. Of course, we have to look here at certain issues. When you talk about numbers, you talk about transparency also. I think in Jordan we are transparent, but some countries around the world are not transparent. The other thing, how much testing you are doing. And believe me, there isn't too much guidelines of how much testing you should do to say that you are testing enough. Some people say you have to test at least 10% of the population. Some people say if you test 1,000 and you have more than 10% cases positive, then you are not testing right. But at least we are doing some good numbers of testing, taking consideration that the Gulf countries are doing much more testing than Jordan, due to several reasons. Okay, so if you compare our curve with the surrounding countries' curve, you see that here in Saudi Arabia and Qatar, the curve started to flatten in a way or another in the last few weeks. Saudi Arabia and Qatar flattened. However, in other surrounding countries like Bahrain, Kuwait, they are still going up. And even United Arab Emirates, they started to do better, then they started to going up. So the situation is not yet very clear, but we are getting a deeper slope now. And we are not really, we don't know where we are going. I can tell you one thing, we are going to have more cases in Jordan in the next few weeks or a few days. Right. This is Jordan. Jordan, as you know, 12 governorates, 12 محافظة. This is Irbid, or as people called it in Jordan, Wuhan of Jordan, in the beginning of the story. And if you look here, this is the second slide here. These are the الألوية التي في محافظة Irbid. And these are the cases which we started to see in March in cases of Irbid. And let me give you, this is, if you look at this slide, this is a very important slide. I followed 120 cases that were detected in Irbid in the beginning. And if you can see, most of them, the first pandemic was secondary to the guy who came from Spain, the one from Spain, who ended up with the wedding of Irbid, or Urs Irbid. The second case, there were two cases, we don't know where did they come from. Then we have a driver number 1, a driver number 2, and we have also a guy who was a physician who came from Spain, and to go around the system, he went to Italy and he entered Jordan. So all of our epicenters were for people who are coming from outside, and that was the beginning. That's why, if you look at this slide, these are the numbers as of June 9, 2020. The curve in Irbid started to be so flattened, and the cases continued to be in Jordan. So this is 129 cases in Irbid, 709 cases in Amman. The slope is going up, and the slope here is flattened after taking drastic changes in Irbid. So the wedding happened on March 13th, and the lockdown in Jordan was enforced on March 17th, and the airport was closed on March 17th, and people started to have a fear of Irbid. And when this case, and you remember, most of the cases were secondary to the wedding of Irbid. So Irbid was the center of the problem. And everybody was scared that since we don't have other cases in other parts of the country, so we should do something for Irbid. So on 26th of March 2020, there was a defense order that formulated اللجنة التنفيذية للتعامل مع وباء كورونا في محافظة إربد. And I'm going to start here presenting the case what happened in Irbid. اللجنة التنفيذية في Irbid, it was made of the governor. The governor was the head of the committee. مدير المخابرات العامة، مدير الاستخبارات العسكرية، مدير صحة محافظة إربد. أنا كنت أنا مقرر اللجنة التنفيذية، وكان في الدكتور مهند نسور من الإنفينيت، ومدير صحة إربد عضو فيها. يعني الأجهزة الأمنية والمحافظ والصحة إربد ومستشفى الملك المؤسس والإنفينيت من المجتمع المحلي الأردني عن الإبيديمكس. And this is the core of work in this committee was having three columns: the governance الحوكمة، الكونتنت تريسنج راح احكي عنه الان بالتفصيل، والكيس مانجمنت. I think the success that happened in Irbid was because these three pillars were working greatly together. The governance was very important, and I think المحافظ في مدينة Irbid, the governor, did a very good job in delegating the job to those who know the job. He was listening to everybody. He was just coordinating between people, and he did a good job in doing this. And these are the governance issues. And the most important of the governance issues, the decentralization. احنا بنحكي صار لنا 4-5 سنين على الأردن عن اللامركزية. أنا أعتقد تجربة إربد حققت يعني أول تجربة حقيقية في الأردن عن قضية اللامركزية. أصبحت القرارات تتخذ في محافظة إربد. وزارة الصحة كانت تقدم الدعم اللوجستي، سوابس، فحوصات وطبر، لكن القرارات الذاتية، يعني إذا عرفنا كان في مثلا عمارة فيها عدد من الكيسز، كان قرار عزل العمارة ما يتخذش أكثر من 5 minutes. تنفيذ القرار ما ياخذش أكثر من نص ساعة. And this is very important in contact tracing because you don't want these people to go out of the عمارة ويروحوا وينشروا المرض somewhere and some there. And that was very important. In one day, we isolated 17 buildings in less than 1 hour. 17 buildings. And this happened with the students who came from occupied Palestine. When we went back, they found some cases among them. So we have to isolate their buildings. القضية الأخرى اللي it was very important with this طبعا إنه since Irbid was the center of the problem in Jordan, at that time it was so wise to make a military built around Irbid. طوق عسكري حول إربد وعزلها عن بقية محافظات المملكة، لأنه that time ما كنا مثل اليوم حالات في كل مكان في الأردن. الحالات كانت فقط في إربد، فتم عزل إربد عسكريا، ما حد بيطلع ولا حد بفوت. كما تم عزل 5 مناطق في إربد: جحفية، أيدون، سوم الشناق، المزار. تم أيضا وضع أطواق عسكرية حولها. So عزل داخل العزل, which I think was appropriate at that time. It's not appropriate today because today the virus is everywhere in Jordan. كرك اللي كانت قلعة يعني محمية من الكورونا أصبحت الآن بؤرة جديدة من بؤر الكورونا في الأردن. So that's what we did, military built around these areas. And this is just, I told you about these outbreaks. And we started also to apply the GPS in identifying the cases and identifying the areas of patients and cares. So, مثل ما حكينا لكم الأول, there was a pillar, governance, then case management, and contact tracing. الأمور, it was so simple in the beginning. Any case in any hospital in Irbid that is suspected to have COVID-19, there was a phone call from whoever physician in the ER, in any hospital, in any of the hospitals of Irbid, to me or to who is on call in King Abdallah University Hospital. And the civil defense will be transferring this patient in a few minutes. سيارات صرنا نسميها سيارات كوفيد في إربد، مجهزة يعني اسمها كوفيد كار. فتطلع السيارة, and when he comes to the King Abdullah University Hospital and Dr. Al-Ghazo is here, there was a certain track. These patients will not be mixed in the hospital. They have a certain track, certain route, certain elevator, certain floors. حتى الفلور اللي كان عندنا في مستشفى الملك المؤسس فيه غرفة عمليات استخدمناها 4 مرات لإجراء عمليات قيصرية لنساء مشتبهات إنه عندهم COVID-19. And we have a problem yesterday with this case yesterday. So يعني احنا مش منطقة عزل المرضى في مستشفى الملك المؤسس كانت تعتبر وكأنها مستشفى آخر ليس له علاقة بمستشفى الملك المؤسس functionally. So suspected case management in the hospital. لكن العمل العظيم اللي صار في إربد أعتقد هو ما قامت به فرق التقصي الوبائي. قسم التقصي الوبائي في وزارة الصحة في إربد كان يمتلك 4 إلى 5 فرق تقصي وبائي, which they were doing great job. They are still doing great job, لكن they were not enough. So نقابة الأطباء مبادرة وطن, they brought in 25 teams. The 25 teams with the 25 cars, with the 25 drivers, with almost 100 physicians, that they were going everywhere in Irbid for contact tracing. من كريمة للمخيبة. Everywhere they were doing this, and they were doing this out of their bucket. They were not, يعني سيارتهم بنزينهم everything. So they did a great job under the umbrella of Ministry of Health. And these people were very good because they were reaching the patients and the contacts in appropriate time. Within 24 hours, everything, even the results will be available. And that's because we were having the important samples to be done at King Abdullah University Hospital laboratory. So what I'm telling you today, of course, we published 5 articles at King Abdullah University Hospital about this COVID-19. It is very important to recognize what happened in فرق التقصي الوبائي والعمل التطوعي الذي قام به أطباء في محافظة إربد وأتوا من محافظات أخرى بالمناسبة في مساعدة فرق التقصي الوبائي في وزارة الصحة. They were under the umbrella of وزارة الصحة, and they did a great job in making some logistics and following the patients and contacts. القضية المهمة جدا I think اللامركزية في التعامل مع الحالات كانت مهمة جدا. اتخذ القرارات بسرعة, تنفذ القرارات بسرعة, because as Dr. Hadin knows, contact tracing, you need to reach the patient immediately. You need to reach the contacted immediately, otherwise something will happen. However, كل الشكر لهؤلاء. I think what happened in Irbid in the beginning might not be a good example now, because now the virus is everywhere. We need to do something else. And this is up to the strategies and the policies and committees. And thank you very much.